The meeting of the Radnor Township Board of Health for October 19, 2009 to order. And if we could all stand and recite the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Larry, I have a few announcements. One is to welcome Amy Leader. Doctor, welcome to our Board of Health. And if you could give us the snapshot background, mostly for the audience, as you can see it all back here. Oh, yeah.
There we go. Okay. Hi, everyone. I'm Amy Leader. I work at Thomas Jefferson University. I have a primary appointment in the Department of Population Sciences Medical Oncology Group at Jefferson and a secondary faculty appointment in their School of Public Health. My background is in cancer prevention and control and in public health. So I mainly do community-based work around cancer prevention and control issues. Right now I'm working on a large study in West Philly and North Philly with adolescent teen girls and the uptake of the HPV vaccine. So I'm really interested in cervical cancer prevention and some of those issues. And previously to coming back to this area, when I was in DC, I worked for the Washington, DC Health Department, and I was down there for about 5 years. And I did mainly cancer prevention and control and get detailed to emergencies as would be needed. I worked the anthrax outbreak after September 11th for 4 months in DC with the postal workers. And I hope we don't ever do that again. And I'm glad to be back in this area. So.
Well, thank you very much, and obviously well qualified for the board here, far more so than I am. So I think that's a very good thing. And again, thank you for your willingness to serve. Also, Larry, if I could take a moment. Stephen Banner, am I saying that correctly?
That is correct.
Okay. He is one of our fine police officers that serve Radnor Township very well. And he notes that he will be participating on January 30, 2010. I can't believe I'm saying that. 2010 in the for a fundraiser for the Special Olympics of Pennsylvania. It's the annual polar bear plunge in Neshaminy State Park. Officer Banner has a child with special needs, and he is looking forward to raise funds for others like his daughter, Madison. There'll be some participation in Special Olympics swimming at Villanova, and in any event, he's looking to raise $1,000 towards this goal. And if anyone is interested in a donation, they can donate any amount or take the plunge with Officer Banner. I don't know if I'll be doing that, but certainly a worthwhile cause. All the donations are tax deductible. And Larry, where should they be sent, the donations?
I would have to check with Officer Banner. The only communication I had was there.
Okay, and I assume you can look up the Special Olympics on the web, and they'll probably have the appropriate information. So any support anyone here or in the audience can provide for this worthwhile cause would be greatly appreciated. Any other announcements before we begin? Oh, yes.
And Amy, you may know about this, but I was going to announce that on Saturday, November 7th at Thomas Jefferson University at the School of Public Health, there are hearings on the Healthy People 2020 objectives. And these objectives are online in draft form for comment. And so I think it's one of very few public hearings around the country. So, yeah. So for people who are interested, I'm trying to think of where I found that out. I'm sure you could Google it and find it, or find out through Thomas Jefferson. But that's the date, Saturday, November 7th.
Mark, do you want to mention the League of Women Voters?
Yes, thank you very much. Also, on November 10th, the League of Women Voters will be having a presentation on a study that's been done regarding the development of a potential Board of Health for the Delaware County. Delaware County, as folks may or may not know, is one of the few counties, at least locally, that does not have its own Board of Health. So the League, as part of many of the worthwhile activities that the League does, has done a study and is going to present those findings here in the Radnor Shire room on the 10th of November. And the time we think is 7 o'clock, but we're not certain yet.
Will that be on the scroll?
I'll make sure it is.
Great, thank you.
And I'm sure it'd be like all League events, will be a very worthwhile presentation. Larry, do you have any announcements?
Other than, unfortunately, Dr. Eon Ballard wasn't able to make the meeting tonight. He's the other board member. He had a commitment. And Dr. Len Donato is not going to be able to make it.
Great. Thank you very much. I sent around a draft of the minutes. I don't know if everyone has had an opportunity to review those. They are also at your table. As you know, with the cost reductions, we're now taking on the responsibility of doing the minutes. So I did these. There's no pride in authorship, so please feel free to amend, correct, delete, or add as needed. So why don't we all take a few minutes and take a look at these?
Well, that's paragraph 5, the last sentence. I hope one day our future minutes will have that statement, but we have not, to my knowledge, been apprised that we have successfully obtained the grant from the Right Aid Foundation.
Great.
So we should probably delete that.
Yeah. What I meant to say was that successfully submitting the grant, my mistake. I will make that correction. Any other corrections or additions? If not, can I ask for a motion to approve subject to the one correction noted?
So move.
Is there a second? All in favor?
Aye.
Aye. Thank you. The minutes are approved as corrected. Larry, can we go to the health officer's report?
Yes, good afternoon to the board members, and welcome to Mrs. Leader. Is that proper pronunciation? Leader?
That's right.
Welcome to Ms. Leader. I do apologize for your late notice. Again, that's uncalled for. It's my fault, and I apologize. When we look at our normal activities for the month, again, we have a lot of complaints that we have to deal with here. And the routine food inspections and the meetings that we attend. I did 12 food inspections, 22 complaints. I was able to recertify on a couple of my certifications there. The board had asked me to get some information on filling vacancies for board members. I think that may be a moot issue now that we're at full boat, but I did provide the information that I could find. We moved down to the Board of Health members, shared information. Mrs. Wishner provided some information on a webcast that's coming up November the 5th at from 2 to 9 p.m. on global climate change. Mr. Hazen provided, as he promised, the agenda and minutes from the EAC meeting. He also, I wanted you to all know that the emergency preparedness grant that he applied for Rite Aid was received by Rite Aid. I wanted you to see that the signed certification card was there. October the 1st and October the 2nd, the Pennsylvania Department of Health did their routine drive-through flu clinic. We didn't find out about it until September the 30th, the day before. So what we did was, as fast as we could, we put it on our website and on our scroll, and we were able to serve 1,200 people in this drive-through flu clinic. It was in Township. They selected that site because it was the only site that was able to handle the parking and had a drive-through where people never had to get out their car to get the shots. So we were happy to serve 1,200 units, but sort of unhappy that we found out about it kind of late. We did speak about the Polar Bear Club. Also in your packet, you'll see, and I have to thank Delaware County Intercommunity Health for their information on locations where residents in Delaware County can get the flu shots, and that's good from now, starting today, to November, I think it's November the 8th. And that, after which time I'll put up a new schedule. I do have that on the information at the front desk here, and we put it on our scroll in the website. So ends my report.
Larry, just a question. Are they free flu clinics, or are they, is there a fee associated with that?
There's fees associated with the ones that are provided that I just referenced.
Okay.
The drive-through ones that I referenced earlier, they were all free.
Thank you. Any questions for Larry? Okay, hearing none, let's move to old business, and Herb, the EAC.
Well, as I may or may not have indicated at the last meeting, I was in fact unable to be in attendance at the last EAC meeting. However, as Larry has indicated, I am being as diligent as I can in seeing to it that the members of this board, as well as Mr. Fisher, get the minutes and agendas for upcoming EAC meetings, as well as relevant material that I get through email from that bears on EAC activities. So I think that has been happening, and I'm grateful to Mr. Taltone for passing those on. And that will continue, of course.
Great.
And I think it's actually a more effective way of keeping all of us in the loop.
Great. Thank you. The next item is mine. Medical environment, healthcare access. As folks most likely know, the state finally did finalize its budget, although there is still some issues, as I understand it, regarding funding through the gaming programs and what is going to be in and not in the gaming program, which is an integral part of the funding for the environment. A couple of key issues at the state level, at least, is that the MCare fund, the provider retention account, which had about $700 million in it, will be used to balance the budget, and that's a key element of the budget. Obviously, that has a number of impacts. One is on whether or not there will be an abatement for physicians going forward. As folks we've talked about before, there's a level, what they call the MCare layer of insurance that physicians are required to maintain in Pennsylvania. A portion of that cost has been abated over the years through use of this provider retention account. The result being that physicians have been more willing to stay in the state because of the fact that this cost has been alleviated. The question now becomes what will happen to at least the independent physicians now that this cost will no longer be alleviated. The other issue is that for years they've been building up the MCare fund in order to retire what they call as the MCare unfunded liability. The MCare fund, when it was started in the 70s, was started as a program to retain physicians because they couldn't get access to insurance. What happened over the years is the program was ongoing. The insurance crisis of the 70s abated, but the problem is that this MCare fund remained. and it was not operated like an insurance company. So they didn't keep reserves. It was just a pay-as-you-go. It was kind of like Social Security. It was a pay-as-you-go system. The result being that they now have this massive unfunded liability in the neighborhood of $1 billion, $2 billion. And if you use this provider retention account query, will you be able then to, at some point at least, hopefully retire this unfunded liability? So big issue for hospitals and physicians in this state. But as it looks now, that fund is going to be used for general fund purposes, and I'm not saying that's good or bad. I'm just saying that's going to happen. That will ultimately impact the physician's cost of doing business and therefore ultimately impact access. At the federal level, I'm sure people are well aware of what's going on in Washington. There are 5, I guess, different bills, 2 in the Senate, 3 in the House. I know that the majority leader is trying to reconcile the Senate Finance Committee bill and the Senate Health, Education, Labor, and Pension, the Senate Help Committee bill. The major difference there being the public option or public health plan. And so we'll see what happens there. Obviously, regardless of what happens with the public option or some of these other more controversial items, there will be some significant changes to health care coming out of Washington. A couple of the major ones I saw the other day is that they want to revamp the way physicians get paid. Currently, there's a law called SGR. The acronym is SGR. It's Sustainable Growth Rate, and it's a means by which Congress enacted several years ago to regulate the growth in physician payments. Every year since they've enacted it, they've done technical corrections to alleviate the draconian cuts that would occur if SGR was implemented. So now they want to have legislation to do away with that. Ultimately, that's got to be paid for under the House rules. So query, where does that money come from? So a lot of things moving down in Washington. There'll be some significant changes on the horizon. What form that takes, ultimately, we don't know at this point. So if there's any questions, I can hopefully try and answer those. I know it's such a light topic, and in any event, on to better matters, the Radnor Health Matters.
Okay, thank you. We've already heard that the proposal to the Rite Aid Foundation has been received by that foundation, and we haven't heard any questions so far, but we did get it in time for the current review cycle, which began on October 1st of this year. So we're still hopeful. We haven't gotten a rejection letter yet, but we haven't heard anything. With regard to, we've scheduled a taping for the first of this season's television programs. The taping will be on October 29th, and it will be, the program will focus entirely on seasonal influenza and novel H1N1. I think it will be a very interesting program and provide the citizens of our township with a lot of useful information. Any questions?
Questions for Herb? Great. New business, is there any new business items? I have one. What are the safety rules for Halloween? Anybody have, do we have those on the scroll anywhere? Do we put those up?
I've never been aware of it.
I think,
Maybe that's something we ought to look into. Yeah, we can put something.
I only do it because I want to make sure the candy I go out and get is safe, so that's important to me. Any other items for new business?
Mark, I'll just bring an issue up. I had discussed the need for a bicycle trail connection to the existing Radnor Trail, and Amy Wishner and I have been going back and forth with this topic. And just to let you know that my goal is to try to get a trail connection from the east side of the township to the existing trailhead at Radnor Chester Road. The proposed trail extension currently will be running through Martha Brown Woods, but will not be usable by bicycles and rollerblades and whatnot. It's strictly going to be a hiking trail. So I've put together a brief presentation that I forwarded to the Parks and Rec Department, and in turn, that presentation will be presented to the Trail Committee. But I thought it might be something the Board of Health may be interested in getting behind as well, because one of the obvious gains from this would be an increased opportunity for healthy lifestyle throughout the township. And we know how long these trail extensions can take to get when they're going through property. So this is an easy win, I think. Some low-hanging fruit in a sense, because there are already sidewalks along most of the path. And really what we're looking at is a need to open up a dialogue with the school district, who has a very large parcel. The Radnor High School is in the middle of this path. So hopefully I will probably reach out to the school district at some point, or work with the trail committee to do so. And this is not in lieu of the existing trail plans that are in place. This is in addition to. So the hope here is that we get some early trail access, and then as the other trail gets built out, we'll have two trails, one serving those who wish to hike, and then one trail system serving those who like to bike.
Comments?
Mary Young is still on the Board of Education, isn't she?
I believe so. I
Yeah.
have to admit, I'm not sure at this moment.
My recollection is she had a lot to do with getting the existing trail set up, so she might be a useful person with whom you should speak.
Thank you.
Good. Anything we can do to foster and promote outdoor activity, athletic activity, I think is a worthwhile endeavor. I think, Amy, you've brought up the fact of a gym, at least at the middle school, is not a full-year curricula. Is that what we understand?
Right, you have gym for half a year, and during that half year, you have it half the time. So it's a quarter year gym at the middle school.
So I think that anything we can do on that behalf, if there's anything special, John, you would need us to work on, or a subcommittee of this group, I think we'd all be more than willing to help.
Yeah, and I think, at least from my point of view, the Board of Health has an opportunity, because of your role, to take leadership in this area. And that is giving guidance to the school district, even in terms of what they should be doing. Their focus is clearly on academics. And maybe this committee, the Board of Health, would be in a position to maybe advise them and give them advice and give them vision, so to speak, to improve the lifestyles of our young students as well as the parents. And I think that's where I'm headed with this, is that we really don't, we don't have, we have a lot of organized sports in Radnor, but what we don't have is a lot of opportunity for just recreational activity. So maybe we can work towards those goals and try to create more opportunities in that area. The bike trail is one example, but I'm sure there are a lot of other ideas that this committee could come up with. And any effort that you put into that, I would really appreciate it. I'd be glad to bring it to the Board of Commissioners and bring it public. So.
Great. Any other items for new business?
The report on the flu clinics, I guess that's...
Yeah.
So I guess this is the third year Radnor offered flu mist at the middle and high schools, and this year also offered it at the elementary schools. And there was a fee attached, the idea being that this was not instead of people getting flu vaccine at their usual source of care, but it was just one avenue. Flu mist cannot be given to people who have asthma or various other chronic conditions. So there are a lot of kids that you would really like to be protected that aren't even eligible for flu mist, but nonetheless, it has the advantage of being intranasal and not using needles. So that's just been the avenue that the schools have gone. So this year, the high school, there were 40 kids who got it, the middle school, 33. Those are just a couple more than than last year and not as much as the first year. And then at Ithan, 42, Wayne Elementary, 12, and Radnor Elementary, 46. When I saw these numbers, I mean, I thought they were pretty low, especially considering this year for the first time the Centers for Disease Control and Prevention has recommended annual influenza vaccine for all children up through age 18. And so it's not yet part of the school requirements as other vaccinations are, but you know, it is a recommendation in America, and it's also recommended by the American Academy of Pediatrics and the American Academy of Family Physicians. So I did query the various school, you know, the nurses and the school administrators, whether this seemed like a worthwhile program to continue, whether there's a lot of effort that goes into it for not that much reward, or whether there's really not that much effort that goes into it, and you know, we should keep it going as a you know, as a kind of as a supplement to usual source of care, medical home immunization. And you know, the feedback was definitely, it's not really that hard for the school to do. Let's keep doing it, and you know, let's continue to offer it as one option. So I think that's the plan. You know, we did talk about offering the injectable flu vaccine, which would be you know, everybody can get that unless you're egg allergic or on, you know, high doses of steroids for something. I mean, unless you have pretty severe problems, but for the most part, pretty much everybody can get that. So there, you know, I think that's under consideration. The vaccine that this year is the novel 2009 H1N1 vaccine is recommended for inclusion in next year's seasonal flu vaccine, whether it can be combined with the two other recommended strains, or whether when they try doing that, they find that there's some, you know, they expect to be able to do that. So there should be, you know, one, quote, seasonal flu vaccine next year that will include what this year is this separate H1N1 vaccine. So that would, you know, if that turns out to be the case, then that would be, you know, part of what's offered next year, because the basic idea is that this novel H1N1 vaccine has become essentially the seasonal flu. You know, that's 99% of the what they're seeing in terms of hospitalized influenza this year is the novel H1N1 vaccine. So, you know, that's just an update on that. And I know the school is considering being a pod for the H1N1 vaccine, which means they would essentially hire this same company that does the flu mist clinics to come, and the school would house the clinic but not be responsible for it. It would be the township that would be doing it in the same way as if there was, you know, any other kind of pandemic. So I'm not sure where they are with the plans. I mean, of course, a big problem has just been availability of vaccine, and but I know that's certainly under consideration. They would like to offer it at the high school as a pod or point of distribution setting, and that, you know, all the logistics of that, of course, would have to be worked out. There was a trial run for a pod, so, you know, there's certainly experience to go on, but it's not happening yet. I mean, I have heard, you know, a number of schools around the state have already offered H1N1 vaccine, and a lot more have plans for it to be offered. So it is happening, you know, elsewhere in the state.
I have what I think a couple of related questions. One is, I certainly agree that in the abstract, the numbers of kids who are getting the influenza vaccine in school is certainly small. That's of lesser importance if we had some way of knowing whether or not the rest of the kids are getting influenza vaccine of any kind.
Right. I mean, you know,
through their primary care physicians. And the other question I have is something that is of also importance for those kids who get a vaccine in school, in the school setting. Does the school notify the child's primary care physician?
There has been, all over the country, and including here, there's been an increased demand for seasonal influenza vaccine. So one can assume that certainly more children and adolescents are getting it than they have in previous years, but you're right, knowing that would be best. There is a state immunization registry that all immunizations are, sort of supposed to be reported to, and they're actually at the moment sort of two registries, one in Philadelphia, one for the rest of the state. And the Philadelphia one is supported by legislation, so all immunizations, the Board of Health there has passed regulations, and they have that authority in Philadelphia to require all immunizations to be reported to the registry. For the state, it's voluntary. Some practices do, some health systems do, but a lot don't, because the system is currently set up to require duplicate data entry and not to accept electronic data, which is obviously a huge problem and Philadelphia is different. Philadelphia accepts data from any source. So they get big data dumps from Children's Hospital. So the state system, for example, doesn't even accept the Philadelphia data. So I know it's in process. They're working on changing it, but that is the way that you really would know that. And it doesn't really make sense to set up a parallel system. Really we need to be working towards reporting to that state registry. All the public sites do already report to it. And at these H1N1 clinics that are being held, different localities are handling it differently. Of course, ideally, you do want to let the primary care provider know that the child or adolescent received this vaccine. Everyone is always given a card, and some sites are working out, in some sites where there are relatively few providers serving that community, they do actually report names of people who got vaccines at a school clinic to those providers. So it would be really up to us Radnor, the pod, to figure out what we wanted to do and how we wanted to make sure that those immunizations were reported. And of course you get into the HIPAA regulations, and there's a lot of things that come into it. So you can't really have, for example, volunteers entering data into the state registry or something like that. It's an ongoing issue of which people are aware of, and there are movements. After Hurricane Katrina, you may have read that there were settings where the fact that they had a really good registry was a big benefit, because they were able to, no matter where those kids went all over the country, people were able to access their immunization records. Mm-hmm. So it is something that we're in Pennsylvania a little bit behind on, and it's in process,
Well, I certainly would support any efforts to turn that situation around, given the enormous effort that is going on into the production, distribution, and administration of these vaccines. It just boggles my mind that we would have no way of knowing in the event of any outbreaks of any size which kids were safe and which kids weren't.
Let me thank you for your efforts there, and thank you for that information. Any other items for new business? Hearing none, I'll call the meeting adjourned.